Fireside Chat. Today, I'm super excited to have Dr. Amanda with us, a physician and fierce advocate in the realm of anti Black medical racism. And she's going to be giving us some incredible wisdom nuggets that's going to help transcend our health and the way that we are treated in the area of medical care. So I'm so excited to have Dr. Amanda with us. She's also a good friend of Dr. Lou Hart, who was our prior guest last week. And so we're grateful to have Dr. Amanda join. Thank you so much, Dr. Amanda, for being with us today.
Thank you so much for having me. I'm really looking forward to the conversation today for sure.
Absolutely. Same here. Do us a favor and elevate this message by sharing it, liking it, or commenting below. We definitely want to make sure that you're engaged. We want to engage with you as much as we can throughout this chat. If you're watching us later on, we still want to hear your thoughts. So don't shy away from engaging if you're watching this after. We definitely want to make sure we are responding to any comments or questions that you might have throughout the course of today's talk. So I'm going to jump into Dr. Amanda's bio. Dr. Amanda Choi, MD, MPH, is the chief resident of the Yale Albert J. Solnit Integrated Adult Child Psychiatry Program. Dr. Amanda received her BA in Spanish from Yale University and her MD and MPH from St. Louis University. Dr. Amanda is currently a Viola W. Bernard Social Justice and Health Equity Fellow, a Diversity, Equity, and Inclusion Emerging Leaders Fellow with American Academy of Child and Adolescent Psychiatry and an American Medical Association and Satcher Health Leadership Institute Medical Justice and Advocacy Fellow. Dr. Amanda has authored over 30 publications, 19 of which she has first authored, and has presented abstracts and oral presentations in numerous conferences. Her research focuses on the mental health sequel of anti-Black racism in children and has been funded by the Yale Child Study Center Pilot Research Award. Dr. Amanda also specializes in the effects of medical anti-Black racism. This is what we'll focus on a lot today. She also writes for the General Press and has published over 20 op-eds in the past 2 years, including but not limited to Boston Globe, Time Magazine, Washington Post, and HuffPost. She has been interviewed on countless radio shows and TV platforms, including CBS News, PBS NewsHour, MSNBC, discussing how racism affects the health of Black Americans, and most importantly, what we can do about it. I am so excited, Dr. Amanda. I tell you what, every time I read your bio, it gives me another level of hope and inspiration for this work. Again, thank you so much for being with us, and thank you for the work that you are doing in this space.
Thank you so much for having me.
Absolutely. So let's jump into the questions. We have so much to cover. I think I want to start off, Dr. Amanda. When you see a physician that's in this work, that's passionate like the way you are, the first question I always want to know is what inspired you? What was it that defined your or certified that you're supposed to be doing this work? I'd love to start there.
I think that's a great question. When you think about like how I grew up, I have always been a very opinionated person. So even as a very young kid, like at the age of 2, I was telling people my opinion. If I didn't like something, I would say, I don't like that.
Yeah.
So as soon as I could talk, I was sharing my opinion. And I think, my parents both did a really good job and continue to do a good job of really teaching me that, you should share your opinion, hold your ground, say how you feel, and that there's nothing wrong with disagreeing. You can do that in a way that is, polite. And they really helped me to sort of channel that opinionated spirit that I had. And, my mom always would tell me, make sure that you're fighting for the right side.
Incredible.
And because she knew that I probably was going to use this fire and the spirit for something. And she wanted to make sure, I was fighting for people who truly need it. And so I think getting into medicine, I just started seeing a lot of racism. I mean, I just started seeing a lot of racist behavior, a lot of racist comments, mostly about Black patients. And I just couldn't be silent. It just was something where I kind of just decided one day, am I going to continue to allow people to, make jokes that Black children will probably join gangs, or,
Mhm.
laugh when, a Black person comes in with a gunshot wound? Like, there
Wow.
was just blatant, just anti-Black racism that I've experienced since starting as a medical student. And then also
Mhm.
just hearing stories from other Black physicians from just around the country of things that they've seen and heard. And I
Wow.
just decided, like, this is not something that I'm going to allow, not on my watch. And I just remember, you know, um, the first time I experienced having a Black patient who was called the N word in the hospital by a white patient, and just seeing predominantly white staff do nothing to help the Black patient. And I
Wow.
found out about it after the fact.
Sure.
And just my anger and my rage that the N word was so common in many hospital settings.
Wow.
Yet Black parents aren't sometimes aware that their Black children are being called that. And
Oh, that's
oftentimes
really
Black children aren't being protected. And so I just decided, I wasn't going to allow it. And it happens a lot to Black staff as well. Like, I remember a white patient coming in and a Black staff member being called the N word repeatedly, and being told, by a white supervisor that they were desensitized to the N word. And, I just went to the Black staff afterwards and I just said, you know, they may be, actually, first I told him, you may be desensitized, but I'm not. That was the first thing that I said. And the
Right.
second thing I did was go to her and ask, was she okay? And of course she wasn't. And I basically just told Black staff, well, I don't care how often you all have heard the N word. I'm not going to allow it, not on my watch. And I just remember they're like,
Mhm.
okay, Dr. Calhoun, and they were like clapping and stuff. And it's like, that shouldn't be. I didn't understand at the time why that was such a
Mhm.
monumental statement. I figured, isn't everybody protecting people from being called the N word? But as I saw more and more, I realized that usually when things happen that are egregious towards Black patients, most people
Mhm.
remain silent. And I just decided I was not going to be silent.
It's so powerful. It really gives me goosebumps to hear you say that. But when you're talking about the environment, when we came, excuse me, before we came on live, you started to describe anti-medical Black racism, and one of the things that you talked about is the experience of your patients, and you said when they're experiencing this racism, it's violent.
Mhm.
And I have to second that. It is emotionally and psychologically violent.
Mhm.
We know it to be a microaggression or micro assault, but it is very emotionally debilitating to be in an environment and to have to be subjected to that. And so, congratulations to you for being that advocate in that space, knowing that that is not an easy stance to take. Which is why you talked about the silence factor. Many people would rather remain silent than say something because of the cost. And you being willing, even at the age of 2, to say, I don't care what it costs me. I'm going to give my opinion and I'm going to say what I need to say.
Mhm. Yeah, exactly. Because, and you have to sort of weigh it. And I always tell sort of other Black people, because the risk that we have when we take a stand against this is not the same as the risk that non-Black people have. We
Sure.
have more risk always. But, you have to weigh the two. And for me, what I usually tell people who are trying to say, who are sort of grappling with, how do I, as a Black person, stand up against these things? Should I say
Yeah.
something? Should I not?
Right.
I invite them to check in with themselves. Test it. For me, when I did not say something, that was more damaging for me than saying something, because I would go home thinking, and this happened kind of a couple times as a medical student. I would go home and just think, wow, I could have said something. What if me taking a stand here had made a change for this patient? I just knew that it didn't sit well with me,
Right.
but I also am a person who, like I said, have always been very vocal. I think very quickly on my feet. I can come up with a quick answer to a question. And so I've told people, if you're not a person and it's uncomfortable for you, or it's very difficult for you to say something in the moment, that doesn't mean it's over. You can always go back and report people. You can go back and lodge complaints. You can go back and reach out to other people who are in the situation and
Right.
check in with them. And so everything doesn't have to be, immediate and right then. But for me, I just knew, what has worked best for me is to say something corrective in the moment when it happens. And I just find that, that has worked really well. And sure, there's a lot of risk in it. I would say one of the biggest risks is probably not being liked, and people laugh about that. But I think, in the workplace, and people really want to be liked. And so if
Sure.
you have colleagues who are making racist decisions and saying racist things, for you to say, wow, that was a racist statement, that
Mhm.
was racist behavior, that colleague probably won't like you anymore. And for some
Absolutely.
people, that's upsetting to them. So you
Right.
do have to let that go. So
Mhm.
I'm sure there's lots of people who don't like me, and it's okay. I don't like them either.
I love the honesty here.
We don't have to like each other. We just have
That's
to work
right.
together.
That's right. Absolutely. I think you said is really important. It's really understanding or assessing. Do I say something in this moment? And even if you, for example, got paralysis and you couldn't say anything, like you said, it's not over. You can always go back. You can always do something about it. It does not have to stop there. And so I love that you said that. And the last thing that I want to highlight is the decision you make of whether you should say something based on what it will cost you. So emotionally, if you're going home and this is eating you up and it's just sitting on your heart, your mind, and it's sort of overwhelming you, then that the cost is greater to not speak than to be silent than to speak. So I love that. And I think those are very important nuggets that we can take away with us. So I think there is the element of, will I be liked? Will I be ostracized? Will I be rejected? People typically want to be in the end group. They want to be in the end crowd. They want to be, liked and popular and where they work. And so there is an element of risk. And I think that's just something that we have to accept when we have this call to advocate for our community and our clients.
Definitely, definitely.
Incredible. Well, I want to jump into some more questions, Dr. Amanda, to get some more insight. So you talk a lot about anti-Black racism, anti-Black medical racism. But
Mhm.
for those that may be like, what in the world is that? Can you break that down and explain it to the everyday person?
Yeah, so I would define it as sort of racist behaviors. We can get into my definition of racism, but to break it down,
Mhm.
racist behaviors specifically inflicted upon people racialized as Black. And I say racialized as Black because race is a social construct, like it's made up. So I say Black people, but it's really people racialized as Black. So basically, racist behaviors, mindsets, policies, etc., that are inflicted upon Black people in the medical system or in medical healthcare settings. So basically, I focus a lot on what does racism look like in the doctor's office? What does racism look like when you're admitted to the hospital as a Black person? And picking that apart, because it looks very different, or can look very different, from racism outside of hospital walls. So there was a piece that I published recently in Boston Globe that talks about what I call medical brutality. And the fact that, we talk a lot about police brutality inflicted upon Black Americans, but we don't talk a lot about medical brutality. A lot of the
Sure.
reason, I think, is because of HIPAA, which are, patient privacy laws, which
Mhm.
ironically can serve to not protect the patient, but to protect the aggressors, right? Because if you're
Wow.
in the hospital and you see a racist clinical scenario, with a patient that is not your patient, then you cannot access that chart. You cannot speak about that particular thing because it's not your
Mm.
patient, because it violates the privacy of the patient, right? Which is
Wow.
true. And also, it works to also protect racist people. So
Wow.
that piece is all about that, and how
Wow.
medical brutality is really killing Black people by neglect, by ignoring
Mm.
them, by delaying diagnoses. It's not throwing people on the ground, like although sometimes, interestingly, that happens as well, because a recent
Wow.
study that came out showed that Black children are the most likely to be physically restrained in emergency
Wow.
departments. So actually,
Mm.
it does have physical manifestations as well.
Discipline.
but a lot of it is a delay, not ignoring Black people, ignoring their concerns, assuming that they're not in pain. And sometimes we still survive, and sometimes those delays lead to our death.
Absolutely. That's just first, the way you broke down the HIPAA, that I definitely am going to have to go and read the medical brutality piece. And then I am going to challenge social workers to really begin to rally behind the advocacy for around the HIPAA that you're speaking of. I want to read it first. And I want to share it with my colleagues, especially in New York City, social workers, some of which may be watching right now, because I think we are governed by HIPAA. We are governed. We swear by HIPAA. But if there is an element that is protecting abusers, aggressors, or racist individuals, then we have work to do. And that is a huge problem, especially because this is a law. This is something that every institution that works with clients in America has to follow. So how many times are these cases being swept under the rug and being ignored in the name of a law that's supposed to be protecting our data or our privacy?
Exactly.
Yeah. So I'm just in that moment, I'm like, that's a pause moment for me, Dr. Amanda.
Yeah, I mean, it's just like if you think hypothetically, if you were in the hospital and you saw something happen, right? Like, let's say you saw a patient be, like I mentioned, physical restraints, be physically restrained, and the person said a lot of negative comments about the patient, a lot of negative racist comments, or you heard comments about a patient and you had concerns that their care was being delayed in a way that could kill them. You really would be, since that's not your technical patient, you could get in trouble for getting involved in that patient scenario, because they would say, that's not your patient. How do you know what's going on with that patient care? You shouldn't be in that, because you're not allowed to, of course, access patients' charts that aren't your own, right? So if you were to see something visually, even just walking down the hospital hallway, and you had concerns, it becomes very dicey when you bring these things up, because one of the first things they're going to ask you is going to be, well, is that your patient? Right? Even if you're trying to protect the patient, it can serve to protect, the aggressor. And so it's something to definitely think about. And I actually wrote another piece recently for Boston Globe about that you might have read, but about why like police, I think doctors need to wear body cams. So that piece went somewhat viral, and people were weighing in on, how is this going to affect patient privacy? And, what I was explaining is, first of all, it's just an idea, but, we have all types of cameras in the hospital already, and you cannot readily access that footage, right? You would be breaking a law, just like you can't readily access someone's medical chart. But I think that we should have footage that is tied to people's private medical chart that shows the care they received in the hospital, because if something happens to that patient, they're harmed in a way that the family wants to sue and says they were treated unfairly, they die, you can see the behaviors of the healthcare providers that took care of them, and see with your own eyes, you'd have a committee and everything, and a judge, whatever, jury, what happened, and it would give you objective evidence. Because the problem is, patient discrimination and patient racism is illegal. You as a doctor, can get your medical license taken away if it's proven that you had bad intent and an intent to hurt somebody. But who is going to say, yeah, I'm a doctor and I'm racist against Black people? That would be not smart. Right? So it's very hard to prove when patients have concerns that, doctors engaged in racist behavior. So I think we need objective evidence.
Dr. Amanda, I think that's incredible, and I second and stand by that. Body cameras for medical doctors. I wonder how many lives would be saved, how much care for Black individuals and patients would improve drastically, just because they know you're being watched, and people, and if you are treating this patient unfairly, that will go into evidence in the court of law. I think it will definitely cause a cultural shift in our medical institution. And I would love to see a law like that pass. I mean, it would take a lot of advocacy, a lot of work, a lot of changing of policy systems, processes, and practices. But I think it's definitely it's realistic. I think it's what we need, especially with the level of racism and discrimination that patients are experiencing that unfortunately are leading to the death of many Black individuals.
Yes. Yeah. And I mean, at the end of the piece, I say I'll volunteer to wear one because I would be fine with wearing a body cam
Love it.
as a physician because I have nothing to hide. And when I take care of my patients, I'm always thinking in the back of my mind, would I want someone to treat my family member like this? Or what if this patient's family member was overhearing the way that I'm talking about this patient and caring for this patient? Would they be happy or would they be upset? And I think if you think about that in your behavior all the time, then
Sure.
it's going to shape your behavior in a very different way. But I just think, there's just a lot of bad behavior that is allowed in hospital settings, and patients aren't always aware of it. And I think, you want to believe that doctors, teachers, police. You want to believe that all these people are out to protect everybody. But the reality is, in medicine, Black and white people, Black people have only been allowed legally to be treated in the same medical spaces as white people for 50 years. You think about
Wow.
it, only 50 years.
50 years.
Before that, we were separated. You would be turned away as a Black person and allowed to die on the street if you were in an all-white hospital. That was 50 years ago. So the fact that people want to believe, I understand a lot of people want to believe that everybody has good intentions. And I understand that is people's belief, but I don't have that belief because it doesn't make sense to me logically that you had people who were turning away Black people. 50 years have passed and now suddenly we have a complete mind shift. I don't think so.
Dr. Amanda, it's so I tell you, this topic here, it really I could talk about it for hours. I grew up from a very young age. I want to say at the age of around 2, like you, and grew up learning about racism and it being a social construct, and so this is very deep rooted in my heart and my soul. And when I hear this stuff, it really gets me angry, because when you're thinking about even what you said, the 50-year mark of us being able to be treated in the same spaces and same medical institutions as white individuals, that makes me think about environment. Policy, how much of our policies have changed over the 50 years, how much of our culture, our practices. I wonder, I mean, there's so much that we can get into, but what has been put into place to ensure that there's actual equity and fairness and treatment in these institutions. What are we following? What's the model? And how do we know it's happening? And who's overseeing it? And if it's not happening, then what could patients and people do? So I love the idea of the body camera. Again, I am fully in agreement and I'm seconding it. And I'm gonna get some social workers, Dr. Amanda, to really stand by your work.
Let's do it.
I mean that. I seriously mean, I'm saying it publicly, to stand by your work, because I think it is crucial to the well-being and the health and the life of our communities, especially, Black people.
And, there's also, a lot of healthcare providers that have come out now more and more about the abuse they receive from patients, right? So it works both ways, right? So if a person comes in and says, I was abused by this patient, show me the footage.
Sure.
Did you do something and not to blame, but sometimes I've seen some situations where people, sort of label, and I see it most times, white healthcare providers labeling Black patients as violent, as, needing to be restrained.
Sure.
And I go into the situation and they are the calmest, sweetest person. They're just really upset, really scared, and in defense mode because somebody's told them, you better do this or you're going to get injected. You better do this or you're going to get restrained. And that type of threatening behavior exists around the country in our healthcare system. And so if somebody threatens you like that, of course you're going to be like, you're going to try to defend yourself. You're going to be in fight
Absolutely.
or flight mode. And so what I try to do is come in and say, hey, listen, I'm the one who signs the orders about whether you're going to be injected or you're going
That's
to be
right.
restrained. And I don't want to go there. Let's not do that. Let's just
Sure.
calm down. But it's things like that where I'm sure if you were to ask that white healthcare provider, they would say they said that because they were being threatened by the patient. The patient was so violent. And so show me the footage. If the patient is violent, we'll see that. And we can, put in protective measures. But if you were the one being violent with your words, then we'll see that. And so I
Yeah.
think, patients do, get treated poorly, and so do healthcare providers. And I don't want to minimize that. But show us in the data, show me the footage. And that could be great training material as well, because lots of times I also see a lot of conversations. I do a lot of kind of consulting work as well, meaning, I'm in a hospital, let's say, and there is concern for a psychiatric problems, like a mental
Sure.
health problem. But
Sure.
sometimes there's just a big disagreement between the
Sure.
patient and the family, and emotions are running high. And I'm sort
Sure.
of brought in to sort of help smooth things over.
Yeah.
And lots of times, if that whole conversation was taped or filmed, you could then replay it and say, here is why this conversation went south. And
Right.
then you felt the need to call security on these Black parents, right? You did these behaviors that came off as very condescending, rude, and you really didn't take into account the fact that this Black family, probably has experienced Black family members who haven't been treated well in the medical system. So there's so many different ways we could advocate for patients and
Sure.
for healthcare providers, but you would see it in the film. And so that's why I wouldn't mind being videotaped, because I would want to know, if I did something to offend a patient. I always
Sure.
tell my patients, please tell me, if I say something that's offensive for you, if I do something, I want to be corrected. I want to get better. But
Right.
I think there's still a lot of defensiveness in the medical field, a lot of we're always right,
Mhm.
and I think that has to change. And I think body cams would be really interesting.
I love that. I love that so much, and I love the example you use. I definitely am a believer of training. Not that training is gonna change anyone's heart, but it will definitely illuminate, people's minds and perspectives, and ultimately, the goal would be that people's paradigms are shifting,
Mhm.
and that they're seeing things differently, they're responding differently, and so I think that, outside of just the body cameras, if there is a way to bring in some mandated training that doctors and physicians have to take around biases and recognizing your own implicit bias that you may bring. I think that will also change a lot of what we're seeing in terms of treatment on both ends.
Yeah, I'm not a huge fan of the term, to tell you, of implicit bias. And I'll tell you why. So one,
Mhm.
we do have some of those trainings, as you know. And I think implicit bias is honestly a way to sort of placate white
Mm,
people. So we don't all have the same biases.
that's right.
Like, yes, we all have biases. Like, I prefer the color yellow, you prefer the color red. Okay, I get that. But anti-Black racism is not the same as a Black person having a negative thought or a negative feeling about white people. And I'll tell you why. So when I think about the definition of racism, my definition of racism,
Sure.
it's basically, discriminatory behaviors, demeaning behaviors, mindsets, etc., backed by social, political, and institutional power.
Yes.
So let's say a Black person, I don't know, thinks that a white person is less intelligent, okay, because they're white, right? So yeah, that would be prejudice, that would be, discriminatory thinking, whatever.
Mm,
But is that one Black person's thought about that white person going to result in white people across the board being denied jobs, getting
absolutely not.
lower, getting like lower value on their house, getting killed? No,
Absolutely.
right? But white people think these things about Black people, and it actually results in us getting less jobs, us dying, right? Us not living as
Absolutely.
long. And so
Absolutely.
I think the implicit bias conversation is not really relevant, because what I'm
Mhm.
talking about is anti-Black racism. And you can
Yeah,
only do that if you have the power. And in this
that's
country,
right.
that's white people who have the power. So I
Mhm.
think it's not the same.
Yeah,
And the work that they need to do is not the same as the work that I need to do. And
true.
actually, if it was all up to the work I needed to do, we wouldn't have racism. If it
That's
was up
right.
to like Black people, we wouldn't be having this conversation anymore. So
Absolutely.
I think that what the trainings miss is that, because they're so worried about, am I going to make people feel defensive, if I'm going to make people feel upset? And so
Sure.
the training that I do is very straight, is very direct. And in fact,
I love it.
I have a lot of white people who have benefited from my training. I say,
That's
you know
incredible.
what? Your racism is not the same as my thoughts. If I have a negative thought about white people, you have a
And
different job to do because of your identity than the job that I have to do. And I think if there was more
absolutely.
direct training like that, then we might see some change. But sort
Yeah,
of we all have biases, we're all contributing to this system. No, we're not. We
that's
didn't
right.
create the system, right?
Mhm. Absolutely. No, I love that you said that, Dr. Minute, and how real it is, because you're absolutely correct. I think sometimes we throw around words like implicit bias to placate, but I think, like you said, you have to be direct with this, because there's nothing indirect about the treatment we receive, the amount of disparities that we deal with on a day to day, the number of people that are dying because of this, and so we have to be direct. I think we've moved from multiculturalism, which was, I don't know, let's say maybe 15 years ago. Then we went into like diversity. And then we started inching on anti racism. I got into this work, I want to say around 2009, with my former mentor, Dr. Mary Pendergreen, who is incredible, who does a lot of work around this and social work. And we dealt with this in an overt way. We talked about systemic racism, organizational racism, how it shows up in institutions. And you're absolutely correct. The work that Black folks do is not the same as white folks. We didn't create the system. We didn't even ask to be over here. We really want to think about it. Like, we were fine chilling in wherever we were in different parts of Africa, and we were brought over here against our will. And so, what I love, and I want to highlight this, is that you are focusing on Black. And I think it's brave of you. It takes a lot of courage, because I think a lot of times we're too afraid to stand up for specifically Black, because the conversation looks very different. We're talking about the intergenerational trauma that Black people face or
Mhm.
have faced versus people that have come over to this country for different reasons, whether it's for job security or to reunite with families. When you're talking about a whole generation of people that have been brutally taken from their land, their language, their food, their culture, their everything, and have been forced to assimilate into a new country against their will, and then have been faced with levels of genocide, brutality, violence, on so many levels in every system. How do you compare the experiences, right? It
Mhm.
affects you medically in a long run. It affects you psychologically, and that's what you're talking about, that overt piece. So
Mhm.
I second that, and I love the fact that you're doing these trainings. I would love to see them happen in every hospital, every clinic, even senior centers, which we didn't touch on,
Mhm.
senior homes, excuse me, where video recording is illegal, and where we've known a lot of Black patients to be mistreated,
Mhm.
violently. Many things have happened because there are no cameras. There isn't any objective data to help support these clients. So I love that you're doing this work. I like, again, the overt effort to stand against anti-Black racism.
Mhm.
For me, it really does. It really does. It makes me extremely, incredibly proud to see that you're doing this work.
Well, thank you so much. I initially, my terminology and my focus has changed and shifted and refined as I've, done the work more and more.
Sure.
And I feel like I was sort of conditioned to want to just say
Mm,
like, oh, people of color, oh, this, but it's like, it's actually not correct, because when
yeah,
you're looking at like the
yeah,
women who are dying at really high rates,
yeah,
regardless of socioeconomic status, it's actually not women of color. It's just
yeah.
Black women. Right. And like,
Okay.
we're thinking of like the high murder rates of like trans individuals. It's like, it's Black trans individuals. Right. So it's
Yeah,
like, it actually, I realized that it like actually wasn't correct to say
yeah,
people of color, because it's not, it's Black
Right.
people, or it's, you know, a different group. And so I think I very much am an ally and supportive of other people fighting other forms of
Sure.
racism. But as a Black woman, as a Black
Mhm.
American descendant of the enslaved, I don't
Mhm.
want to lead an initiative on sort of like anti-Asian racism. I think that an Asian person should lead that.
Absolutely.
And I want to lead the initiative like for my own people,
Yeah,
because it's my own people and it's also the expertise I've chose to build. And I think each group, I mean,
sure,
even focusing on anti-Black racism, because we're such a big,
sure.
versatile culture of people from all over the world, even that is so vast. But I think by putting all people of color into this big box, it's like
Mhm.
it becomes so watered down.
Right.
And I think each group, you know, deserves their own targeted approach. And I
Sure.
just feel in my work, the patients who I've had to advocate for the most, and I advocate for the patients who need it,
Yeah,
whoever they are, however they look, I advocate for the patients who need it.
sure.
The ones I've had to advocate for the most have been my Black patients. And I
Wow.
think when you look at the history of race, you know,
Mhm.
white was created to be at the top and
Sure.
Black was created to be at the bottom. And now
Absolutely.
all the other races are somewhere in between. So,
Right.
right? So it's like we were created, the term Black, to be
Mhm.
seen as the most inferior. And so I think
Absolutely.
to understand Black-white relations
Yeah,
is to understand the relationship of all other groups in a
right.
way, because they sort of bookend.
Yeah.
And so I think that's why I've really wanted to refine my focus, because I
Mhm.
think if you're too broad,
Mhm.
um, it becomes
Not effective.
irrelevant, you know. And I just think, you know, so that's why my focus has been very targeted in anti-Black racism, and really understanding what does that look like. What does it look like when it happens to kids? How do kids
Yeah.
describe it, and how do we mitigate it? And then how do we hold people accountable who are
Yes.
engaging in that? And so I appreciate systems and I appreciate policies and I advocate for those things. But in a lot of
Mhm.
my talks, I focus a lot with other physicians and healthcare providers on individual decisions, because I tell people,
Excellent.
if sometimes the focus on systemic racism has become somewhat of a scapegoat for some people. It's like, oh,
Right.
I'm caught in this systemic racism. There's
Right.
nothing I can do. And
Mhm.
you know, I fell into racism. It's just the
Sure.
system. And it's like, so yes, systems do exist, and those are hard to fix.
Right.
However, you have individual decisions as a healthcare provider every day. You can choose to make a racist decision or not.
That's right.
There's no system or policy that tells me to restrain Black patients more than white patients. You
That's
choose
right.
to do that. And I
That's
can choose to say, no, I'm not going to restrain this Black patient. I'm
right.
going to go on the unit and make sure this is really what we need to do, and see if
Sure.
I can de escalate them another way, as I would with any other patient.
I love
So there's a lot of individual racist decision making that is made. And I think
yeah.
that healthcare providers need to be held accountable for that. You made a racist decision, fix it. You know? And that's the way that I
True.
talk to people. And so I think the people who are ready for my training do benefit a lot from the things that I have to say, but I just don't think everyone's ready to hear that. And
Yeah.
that's okay. I just tell some people, you know what? If you're not ready to hear direct statements about what you are doing that is racist behavior, then my training is not for you. You
That's
are not ready for it.
that's right.
Go to, you know, the beginner preschool therapy where we all hold hands and say everybody has biases, and poor you. Because that's not how I talk. I'm going to
That's
talk to
right.
you like an adult who is in a place of power and
Sure.
privilege. And we have a responsibility to all of our patients. And I
Sure.
think the kids we take care of see that, you know, and they
Yeah.
very much benefit from my approach, which is equitable to all patients.
Absolutely.
And I think it's really important, if we are healthcare providers and we're putting ourselves in this position to care for people's lives, you
Mhm.
should be able to have a straightforward conversation about your behavior. And if
That's
you
right.
can't, then that's a problem.
Absolutely. No, I this is all so incredible. I hope that we have some healthcare providers that are listening right now. We'll make sure we share it out to the groups that we're a part of with physicians and medical providers. But I think everything that you said is absolutely bullseye accurate. You have to be overt with this work, and it is about individual decision making, because sometimes people are caught up in system theories, and they try to take the onus off of them, the responsibility off of them, and say, well, there's nothing I can do, when in reality there's so much that you can do, because you are in charge hopefully of your own actions and decisions and thoughts and feelings and everything else. So you're really pushing people to take accountability, to really deal with a lot of the things that they have been taught, they've been conditioned to believe,
Right.
and that they do every single day. And I think it's incredible because sometimes we need just that, someone to give us a good slap and say, "Wake up! You're the problem. You're doing this, and you
Mhm.
need to change." And you're absolutely right. When it comes to change, not everybody is ready to do that. Some people are completely okay with being who they are,
Mhm.
whereas other people, want to do better, want to provide better care, and care about the well being of their patients. And I know we're out of time. There was one other thing that I wanted to mention, and that was a study, and I can't remember. I'm drawing a blank on who published it. I think it was American Pediatric Journal, and they talked about racism being the number one leading cause of mental health issues in Black children, the number one. And so I think we're talking about this. It really is affecting the overall health of our kids.
Mhm.
It's leading to things like depression and anxiety. Dr. Mann, I'll tell a quick story about my daughter. Oh, I don't know if I should do this, but I will. Who actually goes to more of a predominantly white school, and she's never been in just a predominantly white environment. Typically, it's a mixture. And she recently had an incident where I heard through another parent that she was looking at the cheerleaders in a picture, and they were all white except one girl was Black, and she made a comment, why are all these girls white and there's only one Black girl? And I guess her, a white friend said something like, well, what do you want me to do? And she said, why don't you paint the white faces Black? And I couldn't believe she said that because it's so not my daughter. As moms, so not my Genesis. And so the parent that came to me was a Black parent. I guess they told the Black parent to go talk to a Black parent. And I immediately was like, you know what? It sounds like she is finally realizing that she's a Black girl and it's a lot for her.
Yeah.
And she's only 11 years old and she's trying to make sense of this. And I
Mhm.
said, it sounds like they're not creating safe spaces for kids to talk about race.
Yeah.
So,
Exactly.
it's a deeper issue that is going on outside of what my daughter just said. There's a few other Black girls, and I'm pretty sure they're having very similar experiences.
Mhm.
Um, very similar to her, where they're trying to understand, why am I one of the only, and why am I being treated differently from these other girls? And one of
Mhm.
the things I said to my daughter when we talked, I said, well, first, good job for speaking up. But secondly, there are certain conversations that you can't always have with your white friends because it might get you in trouble.
Mhm. Mhm.
And it breaks your heart, right, to have those conversations because you don't want your child to grow up and to know that because of the color of your skin, you're going to be treated differently. They're going to respond to you differently. They're going
Mhm.
to punish you harshly, you
Yeah.
know? And so what do we do as parents or just as people? We have to advocate. We hold people accountable, like Dr. Amanda said. Then we sick Dr. Amanda on them.
Definitely. Anytime, anytime. Yeah, I mean, I think and the fact is that there aren't a lot of safe spaces, so
Right.
people will say, "Oh, I wanna hear, what you think about this." And I had a
Mhm.
couple instances, growing up where I actually got into some arguments with teachers because
Yeah.
they asked for my feedback on something, but that was really code for, "We want you to say what we want you to say." Like, so for example, we read the poem, I think it's called Bombing in Birmingham, but it's the
Mhm.
poem about the little Black
The
girls
poor
who,
girls
who died, who
in
were
the tree.
murdered,
Right.
and them like getting ready for church and putting on white gloves. And I remember in English class, the English teacher saying, and this is a predominantly white class. In fact, I might have been the only Black girl in the class, which was normal.
Mhm.
What do you think the white gloves symbolize? Right,
Mhm.
asking for our um, opinion,
Sure.
right? And that's where she went wrong because I'm going to give you my opinion. So she's
Right.
like, "Oh, I think the white gloves symbolize innocence and purity." And I said, "I think the white symbolizes the evil white people who killed them."
That
And
was
she was
good.
like, "No, that's not what it is." And I was like, "How do you know? Did you have a conversation with the author?"
That
So we
Yep,
got to this conversation. I
yep,
kid you not, that teacher was mad at me. And I'm
sure.
talking, I was in like 8th grade. for the
Wow.
rest of the year for that.
Oh my
I
goodness.
didn't agree with her that the whiteness
Mm-mm-mm.
symbolized innocence and purity because I didn't see it that way.
That's right.
Um,
Good for
but
you for
that's an
standing
example,
up. Good for
right?
you.
That's an example where people ask you your feedback, but they really want you to say what they want to hear that makes them
Sure.
feel good.
Makes
And
them
I
feel
just,
comfortable.
I've never wanted to do that. And so I
Mm.
figured, may as well not start now. I'll
I
tell you what
love
I
it.
actually think.
I love it, and I would love to see Dr. Amanda as someone take on the cause of creating more safe spaces for children to talk about race. Imagine if you, Dr. Amanda, had a safe space to talk about this when you were a young girl.
Hmm.
How much of a burden these things would just lift off your shoulders. But I think, in essence, that burden helped you to be the woman that you are today. But I think today, again, we need to find ways to create these spaces so
Yeah.
that children can also talk about these issues, because imagine how much they're holding in.
Yes,
And they're
definitely.
seeing it, they're watching, and some of them are calling it out like you had when
Yeah.
you were a kid. And people are telling them, "Shut up, you don't know what you're talking about," right?
Yeah.
But how do we, in education institutions, also create these spaces so that kids are also working through what they're dealing with, their microaggressions and micro assaults as well?
Definitely, definitely. Well, I'm working on it, so
Good.
we'll keep in touch. That's something that
Yes, that's
perhaps look at
incredible.
doing, but yeah, that's what my research is looking at basically is how do we mitigate this, while I work on holding people accountable on the other side, but in the meantime, how do we help children to conceptualize this, and how do we help them to continue to thrive and reach their potential, in spite of, all the challenges of anti-Black racism while we work on fixing anti-Black racism.
That's
Both of them have
incredible.
to happen.
Yes, it has to happen at the same time, and I can imagine Dr. Amanda patients calling out, what they're seeing, like, you're training them to be little advocates, the little kids, and they're like, "Wait a minute, I know what that was." So, it's empowering our kids as well. I think you are doing incredible work, and I am, giving you a new title as a medical architect physician.
Thank
You're architecting new strategies and methodologies and structures to hold people accountable, to push humanity forward, and to be the real advocate that really truly save lives. And I am so incredibly blessed to have met you and had this conversation. So thank you so much. This has been absolutely eye opening, and breathtaking. Thank you.
Thank you so much for having me. Made my day. It was a great conversation.
Same here, Dr. Amanda. If people want to follow you, reach out to you, want your consultation, or interested in your trainings, how could they reach you?
So I have a website, amandajoymd.com. You can also contact me on Instagram or Twitter, amandajoymd, and then you can also email me. It's just my first and last name at yale.edu.
Absolutely. Thank you so much. And if you can leave just one word of wisdom to those that are watching, parents, Black patients, they may not know where to start, and they may be dealing with overt discrimination in their doctor's office or institutions or hospitals. What would you say to them as we're closing?
I would say, short of emergency situations, don't be afraid to change doctors. Don't be afraid to change therapists.
Mhm.
Don't be afraid to advocate for a different teacher for your child. Trust yourself, trust your gut. And I tell Black people this all the time. You know what situations are safe for you and what situations aren't. And
Right.
while it may be annoying, frustrating, inconvenient to request a different doctor or request a different teacher for your child, it may also just change the whole trajectory. So if you're feeling inside that something is not sitting right with you, don't be afraid to, do something about it and to say, I want a different doctor. I want a different teacher for my child. I don't feel that they're being treated well. So trust yourself.
Excellent. That's excellent sound advice. Trust yourself. If you feel something is not right, we got to have another conversation, Dr. Manette. I'm going to bring you back on. We're going to talk about the education piece and racism, because that's a whole nother propaganda that has to be deconstructed. But
Yes.
trust yourself. We all have like that gut feeling that we get. Make sure you don't ignore that, and know that there are options. You don't have to be treated unfairly. You
Yes,
can get the cure that you deserve.
definitely.
Incredible. Thank you so much, Dr. Amanda. Please reach out to Dr. Amanda. Visit her website at amandajoymd.com or reach out to her on her social media platforms and follow her work. Please get those publications. I know I'm going to be reading mine after this talk. Thank you again for being an advocate for us, Dr. Amanda. We appreciate you so much. And we thank you all so much for tuning in, for watching. Do us a favor and amplify this message and elevate it by sharing it out to your networks, your colleagues, your family, your friends, or your siblings, so that we can continue inspiring our communities. We appreciate you all so much. We love you. Stay tuned. We will be back.